So one of the biggest challenges to supporting mental health in the workplace is stigma. And one of the things that businesses can do to improve mental health and wellbeing in the workplace is to reduce the stigma around mental health. And if people are starting to struggle, then they seek help sooner. And the sooner that people seek help, the better, because then the quicker the recovery, the less time they have off work. And ACAS are now saying that presenteeism costs businesses twice as much as absenteeism. So rather than people taking time off work, they are struggling on with things like mental illness. And rather than taking a few weeks or months off and coming back firing on all four cylinders, they are spending months, maybe years, struggling at 80% efficiency because they're not really able to fully focus because of what's going on. So if you can reduce stigma and if you can get people to seek help, then there are some big gains to be made. So one of the things you can do that is obviously by engaging in training. So either the half-day mental health awareness training, the one-day mental health first aid champion, or the one-day or the two-day mental health first aider course. Because it's a statement of intent. It's the fact that you are supporting well-being in the workplace, but you are investing in training and people that can spot the signs and signpost others when they need help. But also there are other things you can do to reduce the stigma. So Mental Health First Aid England have got a really good resources page. So if you go to Google and if you put in Mental Health First Aid England resources, you will come up with the Mental Health First Aid England resources page. And there are lots of free resources there that anyone can download and use. For example, posters around depression and anxiety. So we're used to seeing normal health and safety posters in the workplace, but when you start sticking up posters around mental health and well-being, then it just starts to drip feed the fact that it's okay to talk about these things. And there are lots of resources there. And there are other resources for employers, such as what is mental health first aid and how do employers engage with mental health first aid in the workplace. So use the resources and also embed mental health within your work practices. So for example, if you do a return to work with someone, ask about their mental health. It doesn't matter if they were off because they broke their leg, partly because being off with a broken leg can still have a negative impact on someone's well-being. But also, if you ask absolutely everybody about their mental health, then they don't feel stigmatized. They don't feel like they're being singled out, and it normalizes mental health in the workplace and other processes as well. So employee appraisals, every appraisal, just ask how they're doing at work, how's their mental health, how's their well-being, and again, it just normalizes it in the workplace. So the more processes where you can make discussing mental health part of that day-to-day event, then the better it will be for everybody. And because they'll feel more comfortable about talking about mental health issues, then when they do start to struggle, they'll be able to talk to you and seek help sooner.